Well, it's a pleasure to be here. Thank you so much, Michelle, and the rest of the team for inviting me to have this great opportunity to spread the word about One Health education. And particularly when we talk about One Health education today, we are not going to be talking about 18-year-olds and above. We are going to be talking younger, which is pretty mind-blowing for a lot of people. But trust me, after this, it will sound a lot more feasible. So let's get started. The presentation is called One Health Education in Action. We are going to go over what is One Health, how do you actually describe it to people, why is teaching children important, how can you actually teach children about One Health? It's hard enough with adults, right? How do you go about it doing it with, teaching children? Who can actually teach, and then when can you teach? Okay, so just a brief background of myself. I'm Dr. Deborah Thompson, and I started onehealthlessons.com. If you haven't yet gone to it, definitely bookmark it. I try to make it as easy as possible to remember, onehealthlessons.com. And there you're going to see a lot of different interactive lessons. We'll go over that in greater detail later on. But for years now, I've been developing lessons for children and also adults focused on One Health. And I have fortunately been able to put out the call to get people to voluntarily translate these lessons, because I create One Health lessons not for the English speaking world, I create One Health lessons for the world. And so it's a collaborative global One Health educational initiative that's actually going on right now. And it would be wonderful to have others included. Okay, I'm talking to adults right now, so I'm going to go through what is One Health to adults. Here's a hint. The way to truly deliver a comprehensive understanding of what One Health is to adults, you have to use a story. And here's my story. This is Jack. Jack in this picture was 7 years old, and he's a friend of he's a son of my friend Amy. And Jack was obsessed with two things, soccer and animals, as a lot of children are. Jack grows up a little bit. He turns into a 13-year-old Jack, and he still loves animals and soccer, as you can see. Now, one day, he starts to not feel so well, and he tells my friend Amy. Within not too long, he ends up in a wheelchair. Amy, his mother, my friend, goes to one doctor, then the next doctor, then the next doctor. Over 2 years, she goes to over 30 doctors. And it wasn't until she found a One Health team, and what I mean by that is a physician, a human doctor, working with a veterinarian, who together figured out that what Jack had was Bartonella, or cat scratch fever. Within a week before his very first symptom, he was accidentally scratched by a stray kitten with fleas. But with appropriate treatment, he was able to get back onto the soccer field and kick the ball. As you can see, One Health you can describe as the combination of environmental health, animal health, and human health. But by delivering a poignant story and a real life story, then you can drive home the point that what was the shared environment between the kitten and Jack? Well, the environment had fleas in it. And animal health, well, the kitten had fleas, and then human health, he ended up in a wheelchair, this poor child. And from that story, somebody can get the full picture of what is One Health. Now, you can imagine, when I teach 8-year-olds about One Health, I do not use this story. Let's dive into how I can actually communicate that. And why is it important to teach children about One Health? I said it once, and I'll say it again. You need to teach 6-year-olds about One Health, 8-year-olds, 10-year-olds, because by reaching out to children, that's how you can efficiently reach out to multiple generations. And that's how you can change society. It's something that people are not comfortable with. People are not comfortable teaching children. Fortunately, from my past, before veterinary school, I was teaching in a middle school and a primary school. And then after veterinary school, I was teaching high school students, undergrad students, and veterinary students. And I was also teaching adults, teaching adults English as a third language for them. So I have a breadth of knowledge and experience teaching a lot of different age groups. You can imagine teaching a 6-year-old is not the same as teaching a 17-year-old, and that's not the same as teaching a 60-year-old, right? You have to know your audience, and this comes down to truly science communication. Now, there is a podcast that I want to make sure everybody's aware of. I just was notified that this podcast that interviewed me came out yesterday, and it's called Cracking One Health. And the other speakers, one is from the Midwest, another was the chief veterinarian at the FAO, and then another veterinarian, I believe he's from Europe. So a wide variety of veterinarians and PhDs, all approaching the One Health concept from different angles. And it's very interesting. So just a heads up, Cracking One Health is a great podcast. Okay, how to teach One Health to kids. Does anybody have an idea of how you can actually go about this? Certainly when it comes to teaching children, you have to get them to interact, right? That's number one, and you have to get them to move. Now, when it comes to teaching young children, like 5-6-year-olds, they are coming out of the me stage. So you can't do a lot of teamwork with them, team activities, they're focused on themselves, let's be real. But when it comes to junior high, middle school, and high school, that's when you can get competitions and contests going to get kids to laugh, right? To get kids to move in different places of the classroom. And that's what I was doing when the brick and mortar classroom was actually happening. But we live in a different world now, right? So the same principles that I use online for classes work in the classroom. And the first thing is you need to use visuals. I've been focusing and going into underserved schools for years. And there's the vast majority of the classes I'm going into have several students that do not speak English as their first language. So visuals are incredibly important, and the less words, especially for the younger children, the better. But for instance, on the whiteboard, I am clearly not an artist, but I deliver an important message. What is One Health? It's the combination of human health, animal health, and environmental health. And you can go as far as it's teamwork between people who care about humans, like say physicians, people who care about animals, veterinarians, and people who care about the environment, and environmental health scientists. And this is what I go over with young children. And guess what? They get it. Now, they don't necessarily always write it the same way, but this child, ignore the spelling mistakes, but this child truly understands that those three things are connected. And keep in mind, there are people who really want to focus on plants as something separate from environment, but that gets too complicated for 8-year-olds. So I keep it the three: animal health, human health, and environmental health. Now this child had a different interpretation, and she wanted to go a little bit more the artistic route. And then this child wanted to keep it nice and simple. But you can see all these children truly understand what One Health is. Now, that was in person in the classroom. We are talking about today. And back in February, I was developing these lessons to meet the needs of as many children around the world as possible. And just like how I first presented the story of One Health, I use a story here, and I use visuals. And I try to not include as words or put English on the screen. I try to make it as visual as possible using images, right? So let's dive into this example that I have on the COVID-19 lesson for children ages 6 to 18 plus. Yes, there's an adult version of this lesson. And we will walk through as if we are actually in a class and you are the students. Okay, sounds good? Everybody's on board? Excellent. Okay. In this part of the lesson, we've already covered what One Health is, we've covered what a vaccine is, we've covered what zoonotic disease is. In the small kids lessons, we talk about what a species is, and we always talk about what a mutation is. At this point in the lesson, we see this is a beautiful forest. Everything is spread out really nicely. The animals are not competing for food, not competing for shelter. There's enough space for everybody. Wonderful. This is ideal. What changes? Can anybody raise their hand and tell me what changed?
I don't know if somebody's trying to talk, but I'll note that that tree on the left there looks pretty unhappy, and got a lot more overlap of people and animals going on down there in the bottom portion. Just a lot more crowding and overlap between the wildlife and the people going on here.
Yep, you got the 3 main points for this. So there's less trees because of human involvement. It could be because they're using these trees for timber, right? Timber production or lumber, or it could be simply climate change. And forests, just like animals, you know, they have to have adjustments based on whatever climate and environment they're living in. So there are changes. Just like Michelle said, there are more animals trying to scrunch themselves into the smaller forest. That in itself creates more stress. When you have more competition for food and shelter, there's more stress, right? And just like for people, as I tell my students, when you have stress, you can develop and show more signs of illness, right? And then look, there's more animals near people. Well, that's no good, because keep in mind, by this point of the lesson, I've already discussed what a zoonotic disease is, and then I repeat that concept with the students. Okay, now in your mind's eye, remember this. Tell me what changes between this and this. I think you can see for yourself, it's a smaller environment, there are more people, there's an attempt for these animals to try to get into that smaller forest, but they're forced out because what else are they to do? They have to be near people. Now, say if climate change or just the stresses of this environment leads to extinction, or say birds having to leave, how is that going to change the ecosystem? Well, when we talk to, say, 10-year-olds, 12-year-olds, up to, well, 18-year-olds, you can talk about the food chain, the food web. You could talk about predator-prey interaction. And you could see when birds leave, I asked the students, between this and this, what are the 5 changes? Number 1, there are less trees. Why are there less trees? Because there are less birds. Birds can be pollinators, right? Birds can also, depending on the bird, of course, eat rodents. And look at the difference between the number of rodents. They've skyrocketed, right? And then what else in the picture eats rodents? Foxes. So foxes have gone up. And last but not least, where are all the animals? They're near people. Why is that? Because people are in areas where animals belonged in the first place. So that example drives home the message of really what One Health is, but in a way that children around the world understand. And I put this slide here to remind myself to speak about an important concept with teaching: repetition, 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 right? And when it comes to younger children, make sure you use as many colors as possible. But no need to worry, if you want to teach One Health, just use these free lessons online to children in your community. So who can teach One Health? I think we all know the answer. Just look in the mirror, it's you. Anybody can teach One Health. And I made onehealthlessons.com easily accessible, not just for scientists, but for the mom and dad staying at home with their child home from school, trying to do the best they can with homeschooling. They don't have to have any science background to teach these lessons. Now this demonstrates that before COVID-19 affected the world, My lessons had already been going internationally. This is my avian influenza, my bird flu lesson being used in Uganda. And this is onehealthlessons.com. Welcome. It launched on May 1st of 2020. And you can see the messages, we live in one world. It's time to talk about One Health. And this website is meant to inspire the next generation to see the world as one. You could see onehealthlessons.com, just to emphasize. And we are going to be diving into the lessons section of the website. You can also see, of course, there's the home page. This actually moves. And so on this website, you see the bats moving, and then you see the camera look at the surroundings. And where are these bats? What's the environment of these bats? They're right near people in a downtown part of a city. That was actually taken by myself in Australia a few years ago. So that just demonstrates that our effect on the environment plays a role in environmental health, of course, animal health, and then subsequently our health, right? Okay, diving into the lessons portion of the website. There are COVID-19 One Health lessons, and then I also have water-focused One Health lessons like waterborne diseases, food-borne diseases, vector-borne diseases. Now, because it was launched on May 1st of 2020, I am focusing all of my efforts right now on this. Why? Because it's needed. And here you can also see that I listed some supplemental learning material in the Facebook page, One Health Lessons Facebook page, as well as Instagram. So please follow there, and then you can get extra learning material based on these lessons. Okay, diving into the COVID-19 One Health lessons. Now, remember what I said when I said that you don't need to be a scientist? It's true. You don't even have to be a teacher to teach this. All you have to do is go and look at this free Train the Trainer video. It's 34 minutes long, and it teaches you how to approach different age groups with these lessons, how these lessons actually work in real life. Now, when it comes to the teachers, like professional teachers for K to 12, so for ages 6 to 18, 5 to 18, they care about lesson plans. They need to see a certain structure. And so I have this here, and it's freely accessible. These lessons are meant for a lot of different age groups. You can see 7 different age groups listed here. I made it as easy as possible. It's made on a PowerPoint presentation, and there are slide notes, both embedded in the PowerPoint presentation as well as separately to allow for ease of delivering the lesson. Now, 3 things that you need to deliver this lesson online. And I tried to make this as simple as possible. It works on Skype, Zoom, Google, any online platform that allows for screen sharing, muting and unmuting participants, and using a chat box. And select a language. There are going to be over 30 languages. But before you actually get access to these PowerPoint lessons, I do have you register. I do that for several reasons. I need to know what country, where in the world these lessons are being used, and if you have any feedback. You can see down here that I ask for filling out a 2-minute survey. You can imagine that's a very small ask for all the work that I put into these free lessons. So I want to know, how do these lessons land in your community? And when I say your community, I'm talking to the international world, right? The international community. How does this work in Senegal? How does this work in Hong Kong? How does this work in Texas, right? I want to know this because that's the only way I can improve on my next lesson. These are all of the languages that people have expressed interest in translating COVID-19 lessons into, which is outstanding. I put the call out a few weeks ago, and within 2 weeks, I had all of these lessons with volunteers working on the translations. And then when it comes to the translations, I have one person translate, and then I have a second person, completely independent, back translate. because there's that saying, lost in translation. I'm absolutely certain that the English version of the lesson is spot on, but I don't speak all of these languages. I need to make sure that there's quality and accuracy in the translations. And when it comes to the interactive activities of these lessons, when I dive into talking about mutations, for instance, I use a tongue twister as an example that demonstrates a point mutation. Now, an English tongue twister translated word for word into another language, that would not fly, right? But when I have other people understanding what works, what doesn't work in different languages, and also in their own communities, that's when I know that the message is going to be delivered. That goes back to the original idea of know your audience. For adults, tell a story. For kids, get them to interact. Now, if you want to contribute to these lessons, if you can confidently write and read in another language, I'm more than happy to add you to this list. There are teams with several of these languages. My email address is onehealthlessons.com, and you can also find me on LinkedIn at Deborah Thompson DVM. When can you actually teach One Health to children? You can do it today, because onehealthlessons.com is available to you anytime, day or night. Thank you so much for your attention.